We are faced with more and more antibiotic-resistant bacteria. Are we now at the mercy of fate, or are there also natural antibiotics? The biggest problem germ in medicine is MRSA, which stands for multi-resistant Staphylococcus aureus. If we get an infection, pneumonia for example, for this problematic germ, there is no medical therapy. You can no longer breathe. You are in hospital, in the intensive care units, but there are no effective antibiotics. Either the immune system wins and defeats the disease itself, like in the old days, or these people will die. In Europe, about 25,000 deaths occur in hospitals because there are no antibiotics against these infections. In Germany, that's 2,300 per year. There are no numbers in Switzerland, but generally speaking, you can divide the German number by 10. The industry is currently not really developing new antibiotics. The reason I hear is the margins are too small. But in medicine, we urgently need such antibiotics that face off against these problematic germs. In nature, there are herbs that have some antibiotic effects. This includes oregano, thyme, rosemary, and barberry bush. That is not a herb, not a spice, it is a bush. These plants contain active ingredients. In the case of oregano, it is the carvacrol. In the case of thyme, the thymol. In the case of barberry, the berberine. There are studies on these substances. These studies can be viewed at pubmed.gov, a public website from the USA, where many medical studies can be found. You'll be amazed at how many there are on this topic. Now, of course, not all studies are about the antibiotic effect of natural products. There are studies on a variety of topics, but there are dozens of studies on these plants and their antibiotic effect. All these substances inhibit bacterial growth, and some of them are even capable of killing the cell wall of bacteria. It is important to know that these natural plants do not work everywhere. The best antibiotic effect we have are in the upper airways, in the throat, tonsillitis, bronchitis, pneumonia, sinusitis. Here we have great effects. For internal organs, a bladder infection for example, there is less effect, but most often the infections are related to the lungs. And here we have real good alternatives. You can intensify the effect of oregano, thyme, berberine if you add vitamin C, magnesium, zinc, selenium. These are all substances that strengthen the immune system. If it is a viral infection, you can add artemisia. The dosage, pretty easy, about 4 times 2 capsules per day until you're healthy. It takes longer than with a conventional drug. The effect is weaker, but it hits the same target, and you save yourself the use of antibiotics, which have many side effects. In the case of bronchitis, for example, I suggest you first to try natural antibiotics, and only go for conventional antibiotics if you need to. You will find a link to more information on the topic. There, you will also find 2 specific studies on antibiotic effects of natural products.